I'm going to introduce the working group 2, Dr. Martin McMahon and Dr. Vladimir Vuković. So Dr. Martin McMahon, he's an associate professor in intellectual disability nursing in the School of Nursing and Midwifery in Trinity College, Dublin. He's an expert in intellectual disabilities, specializing in health inequalities in cancer care. He's a clinical practitioner, an educator, a regulator, and he's recognized internationally. He directs a grant at the moment in cancer and intellectual disability, investigating barriers and investigating barriers and enablers on equitable care. He's also head of the intellectual disability discipline and associate director of TC Aid at Trinity College, Dublin. Dr. Vladimir Vuković. He's a teaching assistant in the Faculty of Medicine in the University of Novi Sad in Serbia. He's a physician, an epidemiologist, and a teaching assistant, and he's affiliated with the Institute of Public Health of Vuković and Department of Epidemiology at the Faculty of Medicine. He has an academic and research interest in cancer epidemiology, seroepidemiology, immunization, HIV and STIs, and health policy. And his doctoral research focuses on personalized approaches to head and neck cancers. So on that, I'll pass it over to them.
Thanks, Florian, and thank you to everybody for being here today. I'm also going to bring up here Dr. Kalia Lima, who is actually going to deliver most of our presentation, and also Mr. Barry Tyner, who's also going to deliver a presentation, which is a little bit unorthodox, so it is. We're going to focus on 3 different areas, so we're going to focus on what we've done. Barry is then going to undertake a little experiment with everybody in the room, so I hope you'll give that full attention. And then we're going to finish with a video. So I think we've got a bit of a hard task to follow with regards to Working Group 1 with the fabulous work that they've done and completed. So we are also on track with getting our work completed. But before I start, I really just want to say, on behalf of Vladimir, as co-lead and myself, just thank you to everybody. And not just Working Group 2, all the working groups, particularly Working Group 3, who we've worked really, really closely with, but to Suzanne and in fond remembrance of John, who was the action chair. And actually, I was really touched by what Suzanne said this morning, going back to the question from Dr. Reedy's PhD around cancer and intellectual disability. I'm working with people with intellectual disabilities all my life. We talk a lot about risk and managing risk in different areas. And the best thing we can do to manage and understand risk is to talk about it. And if we go back 4 years ago, there was very little work ongoing in the area of cancer and intellectual disability. We can take a look at, different areas. So we've got Dr. Martin Kuipers here, who I also want to acknowledge. He was the Working Group 2 lead until 2 years ago when I took over, the immense work that started. Vladimir has been consistent, so he has as the co-lead, and a real Trojan and the perseverance with regards to following up on tasks. So I really want to acknowledge that. But now we're really in the spaces where we're talking around cancer and cancer risks and people with an intellectual disability, and we're starting to move on. So I'm really, really proud as Working Group 2 lead to have made the networks. I know people here who were here today and online that I didn't know 4 years ago. And moving into the future, they're fantastic networks with regards to, I suppose, developing the intelligence and research and, I suppose, interventions. So that's where we start to need to move on to now, regards to what works best to kind of tackle these inequalities and inequities that Suzanne talked around earlier on this morning. So we're really, really proud of the work that we've done. We have a lot of work to do. So I want to thank Suzanne absolutely since, I suppose, I've taken over as working group lead. She's just been absolutely fantastic. So I think Abula Bus, I want to say to Sam, but also, I think we also need to call out, Florian from the start when he was trying to get... How confused was everyone at the start of the cost action with regards to the level of complexity? And Florian started to kind of go into the swamplands and understand that. So then we've got Francois over the years, and we could look at Francois, even though you could have 100 emails from her in an evening time in regards to the work she did. She'd done it out of true care and to try and support us through it. So as a working group lead, and I think as a working group co-lead, we found that really, really important. So where are we now? We're going to talk around in this presentation in regards to what we've done. Barry's going to look at some of the discrete choices with regards to screening in people with an intellectual disability, and then we're going to finish off with a video that I think from Working Group 3 and Working Group 2 that really kind of encapsulates, that we can talk around outputs and we can talk around publications and talk around what we've done. But actually, what we've done is we've created a network that is going to improve the lives of people with an intellectual disability who experience significant inequalities and inequities across the cancer sphere. So I'm really, really proud. I want to thank all Working Group 2 members and all members of the cost action who've contributed so, I suppose, gracefully and I suppose without any consideration probably of the negative impacts that has had on them. We know the extra hours they've done. We know that people do this on their own free time. Well, none of us have free time, but on their own time, so we're really, really proud. So I'm going to pass over to Vladimir, and then we're going to work through our presentation. So thank you all very much.
Very nice. Yes, thank you, Martin. So this was a very nice introduction to our session. So yeah, hello everyone from my side as well. It's really nice to see you everyone together after, it's been 4 years. Can we, imagine? So today we decided to give floor to our younger fellows, so say, Kalia and Barry, who will take the presentation, and we are really looking forward to have your participation in this one. Do we know how to? Just this one. Okay. Sit down. Sit here. Okay.
Can you hear me? Yes. Good morning, everyone. When we were preparing this presentation, we asked ourselves a simple question. How do we summarize 4 years of work in just a few minutes? We could talk about deliverables, but I think that would miss the most important part of the story, because Working Group 2 was never just about producing documents. It was about bringing people together. It was about creating a European network of people who share a common concern. How can we ensure that people with intellectual disabilities have equal access to cancer prevention and screening programs? These questions guided everything we did over the last 4 years. At the beginning of the action, we quickly realized that cancer prevention looks very different across Europe. Each country has its own healthcare system, its own organizational structures, and it also challenges. What might work in one country may not exist in another. So before thinking about solutions, we first needed to understand the landscape. And this became the first major achievement of Work Group 2. We created a space where experts from across Europe could exchange knowledge and experience. Researchers, healthcare professionals, advocates, and people with different backgrounds came together to discuss how cancer prevention and screening were being delivered in their countries. Instead of looking only at our own systems, we started learning from each other, and that's one of the greatest strengths of cost action. The network itself becomes a source of knowledge. Once we had begun building this shared understanding, we faced another challenge. How do we compare systems that are so different? To answer this question, Working Group 2 worked to develop audit and evaluation approach that could be applied across participating countries. It required agreement, countries with very different realities to work together and find common ground. Through this collaborative effort, we were able to generate a comparative understanding of cancer prevention and screening systems across Europe. And perhaps, and more importantly, we created a framework that allowed us to learn from one another in a structured and meaningful way. But understanding the systems was never the final object. Just to mention, this was the protocol that we created to evaluate the policies, to identify and evaluate the policies across Europe regarding cancer prevention in people with intellectual disabilities. But understanding systems was never the final objective. The real question was always about people, specifically people with intellectual disabilities. Do they have the same opportunities to access cancer prevention services? Do they have the same opportunities to participate in screening programs? Do they encounter barriers that others do not face? And most important, are people with intellectual disabilities visible in cancer prevention and screening policies, guidelines, or recommendations across Europe? These questions become the central of the work of Working Group 2. Together, we explored the extent to which people with intellectual disabilities experience inequalities in cancer prevention. And through discussions, evidence sharing, and collaborative analysis, we identified important challenges that we still need to be addressed. So what we found based in our research with that protocol, documents were found in the United Kingdom, the Netherlands, Belgium, and Denmark, highlighting both existing initiatives and the limited policy coverage currently available. 16 documents were found, including guidelines, recommendations, and national strategies. Most focus on cancer screening, particularly breast, cervical, and colorectal cancers. And few documents addressed prevention, indicating important gaps in policy and practice. To discuss these findings, Working Group 2 met in Athens, Greece, where we reviewed the initial results of the policy audit and identified the key themes emerging across countries. And 1 year later, we met again in Barcelona, Spain, to further develop the analysis, prepare the final report, and draft the scientific paper. These face-to-face meetings were essential for strengthening collaboration, reaching consensus on the findings, and shaping the output we are presenting today. Of course, identifying challenges is only part of the story. The next step is building capacity to address them. And as we look back on the last 4 years, we certainly point to tangible outputs. We developed a knowledge base. We conducted audits and evaluations. We organized a training school. We supported short-term scientific missions. We contributed to dissemination activities. For example, this was a picture of one of the webinars. And we identified priorities to future research and training. These are important achievements, but the most significant achievement is something less tangible, is the network itself. A network that brought together people from different countries, different disciplines, and different perspectives. A network united by a shared commitment to reduce inequalities in cancer prevention that create opportunities for learning, collaboration, and innovation. And that will continue to influence research, policy, and practice long after official end of this action. So, if I had to summarize the legacy of Working Group 2 in one sentence, it would be this. Working Group 2 transformed a shared concern about inequities in cancer prevention into a collaborative European effort that generated knowledge, built capacity, strengthened partnerships, and laid the foundations for future change. Thank you very much. So also our accessible summary. So we are a group of people who came together to discuss and understand cancer prevention and screening for people with intellectual disabilities in Europe. We shared experience and learned how cancer prevention and screening work in different countries. Together, we created a tool to find documents about cancer prevention and screening across Europe. We found 16 important documents. We met to discuss the results and what they mean, and we delivered training sessions and webinars. All the work we did will be described in a research paper and report. And today, Working Group 2 has over 125 members and more than 40 people from 25 organizations and 18 countries contributed to the report and the research paper. And together, we built a European network focused on cancer prevention and screening for people with intellectual disabilities. Thank you.
So I'm delighted. Kalia, thank you very much for that. Brilliant. Tour de force of an overview. And I think even in the concise presentation, the amount of work that has went in with Working Group 2 is a testament to the membership. And I think, which is really important, we've had a really solid 40 members within our working group who have contributed really, really strongly with regards to the work that we do on a daily basis. So I think that's the legacy moving forward is really strong. So thank you for that, Kalia and Vladimir. So I'm going to welcome now Mr. Barry Tyner, and Barry is going to talk around ranking of reasonable adjustments from the findings of the work that we have completed. So I'm delighted to welcome Barry, who's also my PhD student in Trinity College in Dublin, undertaking research in the area of cancer and intellectual disability. So welcome, Barry.
Thank you very much, Dr. McMahon. So, first off, everybody's to use their phones. So take out your phones. Hopefully we've got a good enough connection. I'd say the connection is not great, so take a photograph there and get it open, and I'll start explaining. If you can't do the photograph, this is the URL, and you use capital CUPID, CUPID. So, as good students, take out your phones. So what are we doing here? So I joined the project quite late, and but immediately I recognised the incredible amount of work that had been done. And this audit, from my previous experience, this audit was fantastic. It scanned the whole of Europe, and it pulled out a lot of excellent data. And one of the sets of data was actually a list of reasonable adjustments. So our task today is ranking them. These are quite difficult to rank because they're not quite comparable. You can't say like apple to apple. So we're going to do what humans do quite well, which is this idea of trade-offs. So when you go and thinking of buying a restaurant, when you're looking to book a restaurant, you're trading off things like, oh, it's accessible, I can easily get there, there's a car park, there's a nice menu, I like the dessert, service is great, compared to another one. And there's all these difficult trade-offs that are going on. So that's what we're going to do here. This is what you're going to appear on your phone, hopefully, if we get a bit of a reception going. The one you're going to see on your phone is a little bit simpler, but basically you're going to be trading off one service versus the other. And this is called a discrete choice experiment. And it's used quite effectively in service, looking at service offerings and proposing changes. So what we have here in service, you could see that they're similar enough. They both have an approach to information and invitation. One, however, is a standard letter. The other one then has a little bit better, then it has an easy to read with pictures. In terms of a consent and autonomy, this has standard here on the day, whereas this has support decisions. So this seems to be a better one. However, then if you look here, you're offered a choice of dates, whereas this is a fixed choice. So it's not straightforward to do this. There's 4 cards we're going to look at, and we'll work through that.
Sorry, just 1 second. Did everybody manage to log in? Yes, okay, good. One step.
Straight away, we're doing really well. So I'm going to leave you for a few secs. Spend a few minutes, roughly about kind of a minute on each card. Look at the trade-offs. Look overall. You'll notice at the top of each card, there are two things that are kept constant. Those things are important because both services have those, what they call attributes. Vladimir, you're looking at me there. How does that look? Were you able to work through it? Yes. Excellent. So if you scroll down to the bottom, you have a choice to make. Go for it. Yeah, so please, go for it, guys. Let's enjoy the experiment. Have a go. So what is going to come out of this experiment? What we're going to get is data, and the most important thing is we're going to get a feasibility, an understanding. Can we do this at a large scale? Having a scientifically ranked set of reasonable adjustments by professionals, people with lived experience, policymakers, a broad range of people, which CUPID represents, our full population is 150 people, this could potentially be something very useful because there's many settings where they don't have the resources to put everything in and they have to make a trade-off. So we're going to help people in the future to be able to make these trade-offs and prioritize what matters. Is anyone any feedback there on how the forum is going? Yourself? It's going good? No, it's going good. Excellent. Not doing it. Grand job. Oh, you're flying. You've done already. Okay, there's no prize for first. There's a box of sweets. So what's going to happen after today, right? And we're not going to have a lovely display, but what we're going to do is we're going to get data out of this, which gives us, first of all, an indication. Is this possible? Could we do this in a larger group? Could we do it by email? And it's a very simple setup. And the second thing we'd get then is actually we'll get what they call prior knowledge. So this is statistical information to indicate that, yes, these kind of services are most preferred, are these kind of services. And that allows us then, when we're doing the next experiment, we're bringing in prior knowledge, and it bolsters up the statistical power and allows a more accurate output and result. So the goal here is to do a big one, and we'll see that together. So I think most people have worked their way through that. There's a little question at the end as well. Fire in any feedback, and we're going to read that. And any of the results here, I'll feed that back through Martin via email as well, so we'll get an indicator of where we went. So just one quick question. How did you find that? Has anyone got any feedback on that? For your, yes? It is tough. It does. Cognitively, it is a pressure, and we brought that down. There was a good discussion within the group.
Can you explain how there was a lot more there, but in terms of trying to get it done today, to look at like the feasibility?
Yeah. So there's all different statistical power. We dropped it right down to the bare floor because this is a feasibility, that's all. But like in the true one, you'd be looking at doing at least 7 tasks, possibly 9. And these are done for the very popular end of life care, and they're also very popular in frailty studies. So you have vulnerable older people go through these kind of questions and mark the services. So it is possible, but it is challenging. You know?
Yeah, because I think of the ambiguous nature of some of the questions.
Oh, excellent. This is excellent feedback. Yeah.
Yeah, it's because of some of the ambiguous nature of some of the questions. And for example, how our self-perception, if we're going through something, I want to have support and easy read if I don't understand. But if I'm not going through a scenario medically or otherwise in terms of any preventative strategy, I may perceive that totally different. So there's a view in fact and a view in principle in terms of what
that's what I've learned in the last 8 months is the variation. Yeah. And how do you account for that? So I suppose what you'll do is you'll end up taking a perspective as a researcher and doing a very general sweep on it and specifically aiming to a certain area, which would be, say, cervical screening. So it is straight away trying to narrow it in, but it'll be very interesting to see, is it possible, you know?
I've got two reflections. I guess there would be differences between screening programs. So like going to cervical and breast screening, you have to go somewhere. With bowel, it's a home kit. So there would be potentially a difference there in what things would look like in terms of invitation and process that you might need to think about. And also what you might want to think about is what that trade-off is. So, you know, at what point, which box kind of tips the scales over what is service A or service B? You know, is it more than one? Is it one particular thing? Just something to think about.
Actually, you know what? And it's a very short time we had, but that is exactly what this study does. So what you're doing, right? Everybody, nobody got, there's about six people got the same card. So there's probably about 8 groups here got the same card. And then other people got different ones. I'm not explaining that well, but they were randomly sent out. There's a selection of 90-odd cards, but you were only shown 4. But within that, you're talking about, there's a whole statistical thing going on, and it's correlating all these choices, and it's able to pull out that distinction if it works out. And that's what the feasibility. But that's the aim, is to grab that. And the bigger the numbers, the more power. You know, it's actually it's a superb method, but you have to get the actual attributes have to be distinct and discrete, not overlapping. They have to be very clear for how they're communicated out, and also trying to put yourself into the real life position has to be understood as well. So there's a lot of jumping through there, guys. Maybe we have a video to go through, but one more feedback?
I'm just wondering, Barry, are you asking people with intellectual disabilities to complete that, or carers, formal, informal?
That would be excellent down the line.
Okay.
But what you call it, first of all, I don't have enough experience to understand what's involved in that. But I think the next step would be a CUPID-wide membership of practitioners, researchers, that sort of thing.
Yeah, no, I was just wondering, because I think, like Margaret said, it really depends on your perspective and where you're coming from.
Approach, it would be co-designed,
Yeah.
produced. So you're probably multiple steps to get there.
Yeah.
But the power, what it could achieve would be amazing.
No, I think it's really interesting. Like, I think it's really, really interesting. So best luck with it. I hope you get the numbers you need now. You know.
Today's just fun. All we need is 30. We've got enough power there. So fingers crossed.
Great.
Count to 50 in the room earlier.
Brilliant.
And there's a few online as well.
Well done. Great.
Guys, thank you, everybody. Thank you very much.
Wow. Barry, thank you very much for that. We're all, even as researchers, we're learning stuff. When Barry talked to me around this discrete choice experiment, it was really, really interesting. And he's really scaled it back in order to try and complete it today. So, look, thank you very much, Barry. And this will also, in terms of feasibility, feed into our report at the end. So we're short on time, and as I said, that we've taken an unorthodox approach with regards to our presentation. So what we're going to do now is we were going to finish off with a video.
Hi, my name is Dr. Martin McMahon, and I'm the CUPID Working Group 2 lead. And along with my colleague, Dr. Kate Sykes, we asked members of Working Group 2 and Working Group 3 what it means to be part of the network to them. While we know we can measure outputs in terms of metrics, such as number of publications, number of meetings attended, and so on, we wanted to hear about the real nuances, the friendships, the collaborations, the opportunities that being part of CUPID has given them. And this is what they told us.
Hi everyone, my name is Vladimir. I'm an active member of CUPID's Working Group 3. So working closely with Kate, Vera, and many other members of our group was incredibly valuable experience for me. It strengthened my interdisciplinary collaboration skills, it advanced my methodological understanding, and broadened my perspectives on inclusive cancer prevention strategies.
Being part of CUPID Cost Action, especially working with everyone in Working Group 2 and 3, has been deeply satisfying. Whether we met online or face-to-face, there was always an amazing energy and a great opportunity to exchange ideas. The best part was meeting colleagues from so many countries, sharing our stories and realizing we have an incredible supportive team behind us. I'm walking away from CUPID with new insight, great friendship and a lot of energy for future projects.
Hi everyone, thank you for the opportunity to be part of this wonderful CUPID journey. Beyond scientific knowledge and professional development, I will especially value the people I have met and collaboration we have built together. I hope our paths will cross again in future projects.
Hi, I'm Elif Saraç from Turkey, a public health nursing professional. Being a part of this project, CUPID project, felt me very valuable, and it was incredibly remarkable for me. Beyond data, CUPID created collaborations that didn't exist before, and also I learned vital skills about overcoming communication barriers for people with intellectual disabilities, ensuring research to really support clinical practice. It was very incredible and inclusive journey for me. Thank you all.
Hello, I am Şenay Karadağ Arlı. I am a professor on 19 Mayıs University, and being part of W2G means more to me than scientific collaboration. It means bringing together people from different countries for a shared purpose, gaining new perspectives and creating more inclusive solutions together. Thank you so much. See you in the Congress.
The best part of this work has been the people. I've met so many inspiring and skilled people from across Europe, and these connections will continue far beyond the project itself.
Being part of the Working Group 2 has been an incredible opportunity to grow and connection. One of the greatest benefits has been networking, meeting researchers, professionals, and peers from different backgrounds who share similar goals and passion.
First of all, I feel lucky to be part of this cost action. Cost action means awareness. Before I joined this cost action group, in my cancer research, I would exclude intellectually disabled people. These past 4 years, it was an educational for me. Now, I am more inclusive, not exclusive. In addition to this research aspect, I have met wonderful scientists from different parts of Europe. And I really hope that we will continue work together to make this vulnerable people's life a little bit better. Thanks for the opportunity. Thank you everyone. Let's keep together. Let's collaborate, continue collaboration to make this wonderful, vulnerable group of
Hello,
people's life.
I'm Dalia Ibrahim. I'm a member of the Working Group 2 of the Cost CUPID Action. Joining CUPID and Working Group 2 has been a valuable experience that deepened my understanding of inclusive cancer prevention for people with intellectual disabilities. Through collaboration, training, and international knowledge exchange, I learned the importance of accessible communication and inclusive health policies in reducing health inequities. This journey strengthened my professional and research skills and inspired me to support more inclusive healthcare systems globally. I'm grateful to the CUPID Working Group 2 team for this valuable experience.
Being a part of VG2 community of CUPID Cost Action brought me a really great opportunity to know a lot of people who are interested in disabilities, and I already know that working with these people is more complicated than we expected sometimes, and I am really thankful that I could be a part of such a great team.
Hi everyone, Dr. Kate Sykes here, Working Group 3 leader. And on behalf of myself and Martin and our wonderful co-leads, Vladimir and Vera, we really want to thank everybody for firstly submitting videos that we have used to develop this message, but also to thank Working Group 2 and Working Group 3 colleagues throughout the entirety of the CUPID project have been really amazing and worked collaboratively together across Working Group 2 and Working Group 3 to help us achieve our deliverables. And without you all, we wouldn't be able to say we've achieved what we have done and identify areas of future research which are really important to progressing the CUPID project. So thank you again for all of your hard work and collaboration over the past few years, and long may it continue. Take care, everyone.
Okay, guys, I think we're just on time before Sinead gets ready. So on behalf of Vladimir and myself, just to say we really appreciate the friendships and the collaborations, and we're really excited about what the future holds for future collaborations. So thank you all very much. Vladimir?
Thank you. Yeah. Thank you, Martin. So the last, the video that we presented is basically the essence of our group and probably of the CUPID itself. So thank you again.
Thank you so much, Martin and Vladimir and Barry and Kate and all of the members of Working Group 2. I particularly loved the slide which showed the map of Europe and all of the different members and the countries. It was, I kind of gave Florian a little nudge and I said, that's a brilliant slide because it just shows, you know, the extent of the participation, the partnership, the collaboration, and it really has been a huge project. And it's been very profound in terms of the impact that it's going to have, you know, throughout Europe, which is fantastic. So we have a little change in the schedules before I finish up, just to say that we are going to have our taster sessions tomorrow. So we are going to break now for refreshments. But before we do that, would anybody like to ask a question, make a comment, sing a song? So, sing maybe later. Yeah, but if anybody wants to say anything or ask any of our speakers a question, I shouldn't forget Margaret and Olivia either for the Working Group 1 presentation and all of the work that is done. And to reiterate what Suzanne said earlier, the leads of these working groups work so hard. It is like there is an immense amount of work involved. So thank you all and well done to you. I'm sure you'll probably be glad when it's over.
With Margaret. We are not sure whether it was visible and whether everybody who is involved in WT1 heard it, but we want to thank everybody, each of you individually, for supporting us, for working with us, for answering our emails, for being in touch on WhatsApp, and just for all your hard work and the time you spent with us on developing all those documents, papers, and presentations, and publications, going for conferences, taking pictures, and everything, just everything else that was done and shared with you. Thank you so much. You're very close to us, people who are here and people who are somewhere in Europe online. We thank you with all our hearts. Really, truly, you're with us, and CUPID will be with us for a few more years, I guess.